Van Hollen and Ryan for a discussion. Gentlemen, thank you for sticking around. Congressman Ryan, you listened to Congressman Van Hollen in his presentation. Thoughts? You could address each other?
I was impressed with how many charts he could fit into 4 minutes. That was really pretty impressive, Chris. I got to learn from you on that. Yeah, that's right. First of all, CBO is telling us Medicare is going bankrupt in 2021. So the status quo is not an option. The status quo is bankruptcy, and we've got to preserve and prevent that. One thing about Medicare costs going up slower than private sector costs, the reason is Medicare underpays providers. According to the CMS, the actuaries tell us they're paying providers about 66 cents on the dollar under the Affordable Care Act. They'll be paying providers as low as 33 cents on the dollar at the end of the day. And that means providers are going to just stop taking Medicare patients. So yes, government can make it look like it's cheaper if it just underpays providers and pays them less than the cost of providing the care. And what happens is providers overcharge the private payers to make up for the difference, and that's a system that's not sustainable.
Well, let me stop there. What about that, Congressman Van Hollen? The administration does reduce Medicare spending by reducing reimbursements to providers, and if, as Congressman Ryan says, wouldn't that mean that seniors eventually would have trouble getting doctors or finding?
Well, first let me respond to the first point he made, which is that Medicare is going, quote, bankrupt. If you look at the trustees' report, that's not in there at all. What it does have is with respect to Part D, which is the hospital part, that beginning in 2024, and it may be accelerated, that we're going to fall short in terms of the premiums. Part A for hospitals. In fact, it will be about 90% funded on payroll taxes, so you will have a gap that we have to fill. Remember that a big chunk of Medicare is funded through general revenue. In fact, about 50% of it is now. So the suggestion that a shortfall in Part A is somehow bankrupting the program is just false. And
as Jack Lew said, it's not going to fall off a cliff.
It's not going to fall off a cliff. So then the question is, where do we go? And we know that in the private insurance market, we've seen rising costs, in fact, rising faster per beneficiary than in Medicare. So why in the world would we want to turn over seniors to that particular system? We've enacted a lot of reforms. And unfortunately, when the Republicans voted against the Affordable Care Act the first day, they actually would have accelerated the problem, according to CBO, in terms of because the CBO indicated and the trustees, that act actually improved the solvency of the system.
That point is premised upon the idea that they're taking $500 billion from Medicare to pay for the president's new health care law. You can't count the same dollar twice. And the actuaries at Medicare actually put an appendix to the report. I've never seen this before, where they said you can't count $1 in Medicare and then $1 in Obamacare. It's one or the other. So it's either funding Obamacare or it's extending the solvency of Medicare. But back to my original point, yes, if government underpays healthcare providers, it can look a lot cheaper. Here's the problem. For every Medicare patient walking in the door and a provider loses money every time one of those people walk in the door, how likely is that hospital or doctor to continue seeing those patients? And what Medicare is telling us, Medicare itself is saying more and more providers are just going to stop taking Medicare. That's an unsustainable situation we got to deal with.
Here's the problem with Paul's argument. We do have two experiments within Medicare with respect to the private market. One is the Medicare Advantage plan. And in fact, they had to be over-subsidized. The reason we reduced the spending to Medicare Advantage is because they were being subsidized at about 114% of the fee-for-service Medicare program. That was the private plan, 25%. 25% of Medicare beneficiaries choose that. Now, Part D prescription drug program, which, by the way, was enacted without paying for it, and it's going to be a big liability we have to deal with,
although
is funded with general revenue.
One thing, every time that's said, there was a Democratic plan back there that cost more.
Yep.
It was also not funded.
But the point is here, we're talking about this without talking about all the other aspects of the budget. For example, the revenue piece, trying to shut down on some of these corporate loopholes, because what their budget says is let's squeeze Medicare beneficiaries rather than closing those loopholes and using those revenues.
Those are two of his charts where it dealt with the out-of-pocket.
We believe choice and competition, where it's worked everywhere else in the American economy, where it's worked well when applied in healthcare, actually helps people stretch their healthcare dollar farther than a government monopoly with a government board of bureaucrats making the decisions, inflicting price controls, which will deny access of care. The other thing is, he's right. There's a lot of general revenue money going into Medicare. And the law says if more than 45% of the program is funded with general revenue money 2 years in a row, the president has to submit a plan to Congress to make it solvent. That has happened. The president hasn't submitted a plan. Nobody has submitted a plan. You're right. to govern is to choose. The Senate has chosen not to produce a budget. To his credit, he did produce a budget. It didn't deal with Medicare. The president hasn't produced a budget to fix this problem. House Republicans have. Ours does save Medicare and prevent it from going bankrupt. He clearly may not like the way in which we do it, but at least we're saving the system, preserving the program, and not changing benefits for current seniors. And the other last point I would simply make is the CBO is telling us that in 2037 the entire economy crashes because of debt. Medicare is making promises to people that it doesn't have money for to the tune of about $30 trillion.
Congressman Ben Hollen.
To pass a prescription drug bill, as they did, that relies on general revenue, and then to introduce a budget that says we're not going to ask the folks, you know, at the very top to go back to the same tax rates that they were during the Clinton administration when the economy was roaring, and to squeeze Medicare beneficiaries instead is a clear choice. Now, Paul keeps talking about the prescription, the Part D.
That's a non sequitur, I would
No, it's not, because revenue is necessary to support the program.
We're saying take away people's tax shelters at the higher level in order to lower rates and tax them at, for every dollar in a tax shelter, it's taxed at zero. Take away the tax shelter and then you can tax it at a lower rate. That's better for the economy.
The missing piece in yours is revenue, which is why the bipartisan commission said that the Republican plan was not balanced.
Yeah, they want us to raise taxes. We don't.
But let me point out.
There's one more chart.
Because this goes to the question on the Part D, which is the prescription drug program, and this is from the trustees report, and what they say is the average annual increases in Part D beneficiary costs are expected to be greater than for the hospital insurance or the other Part B between the years 2011 2020. So the point here is that the prescription drug bill, which is held up as a model for the competition, in fact, the per beneficiary costs are going to be higher.
These are
than
the
other
same
parts
people
of the
that were
program.
off by 41% on their estimates because they don't think competition works. The other thing is the CBO has told us, as a result of Obamacare, prescription drug costs are going to go up, not down.
But these are the guys that you're quoting, Paul, the trustees.
Well,
and they also pointed out in their previous reports that the primary reason that the Part D program, prescription drug program, came under was because prescription drug prices throughout the healthcare system were going down at the same time.
Competition.
No. This was going down at the same time throughout the entire system.
Congressman Ryan, I want to focus on that out-of-pocket for beneficiaries. You're saying they wouldn't be paying out of the pocket.
So the whole notion of this measurement of out-of-pocket, it assumes that we're going to have the status quo. Look, if the status quo was fine, we wouldn't have to even have this conversation. Status quo is the country's going bankrupt and this program's going bankrupt. This program is making promises that nobody is suggesting can be met. This is why President Obama caps the growth of the program itself. So to measure any reform plan against the status quo that is over $30 trillion in the hole is sort of fanciful. The other point is I'd say we give more money to lower income people to cover their out-of-pocket expenses. And yes, we do believe that choice and competition, having providers compete against each other for our business, is better and will work. And these analyses assume no competition makes any difference at all.
It's not going bankrupt unless you starve it of revenues. And that's why the choices in the budget are so important. And the choice they make, well, no, that's not, because 50% of Medicare is funded through general revenue. So if you provide tax
revenue neutral tax reform, we're not talking about cutting tax revenues.
But the bipartisan fiscal commission who looked at this,
they want tax increases.
Well, they said we need revenue increases. Absolutely, by closing loopholes, and also asking the folks.
You can't say that because we're against tax increases means we're cutting taxes.
You are asking Medicare beneficiaries to take less at the same time you're saying to the folks at the very top, we're going to keep your tax breaks in place.
We could do 2 hours, I think. 10 seconds left. Is this? I know you do this all the time. 10 seconds. Will this get dealt with before the election?
Well, the fundamental question on Medicare, well, the proposal they put forward is a non-starter, and so that's certainly not going anywhere.
And Obamacare is a non-starter for us. So we just have different opinions on health care. We don't think we should ration the program. We don't think we should raid the program. We think we should preserve it for current seniors and then save it for the next generation. And we have a different opinion on how to do it.
Really interesting on this point. Their proposal for Medicare is Obamacare, which they disparage every day. It is what they proposed.
I would not agree with that.
Well, it is. It's a premium support program, except you don't provide the safeguards, actually, for seniors.
We could do a lot more
that's what it is.
Thank you very much for your time, both of you.